Welcome to Graper Harper Cosmetic Surgery. I'm Dr. Harper. Today, I'm going to walk you through your consent form for open capsulectomy and implant exchange. If you have any questions while reviewing this form, please enter them in the portal below, or feel free to ask them in person if you prefer. Let me start by explaining what this surgery is meant to address. Open capsulectomy and implant exchange is a revision procedure used when scar tissue has formed around a breast implant or when the implant pocket needs to be reshaped. That internal scar tissue can tighten over time and make the breast feel firm, look rounder than expected, or even become uncomfortable. During this surgery, I remove or release that scar tissue and replace the implant with a new one. In some cases, I may also adjust the implant pocket, change the implant size, or place the implant deeper under the chest muscle if that gives a better result. This procedure is intended to improve comfort, restore shape, and help create a result that feels more balanced and natural. Now, I want to walk you through what generally happens during the procedure. During surgery, I open the area around the implant, address the scar tissue capsule that has formed, and remove or release it as needed. I then place a new silicone implant, and in some cases, I may reshape the pocket so the implant sits in a better position. Depending on your anatomy and your goals, I may use a different incision than the one used in your original surgery. If the tissue has stretched or if there is looseness in the skin, some patients may also need additional support procedures such as internal pocket reshaping or a breast lift. The exact plan depends on what I see before surgery and sometimes what I find during surgery as well. Next, I want to review the most important risks. As with any surgery, there are risks you should understand before moving forward. These can include bleeding, infection, fluid buildup, scarring, swelling, pain, delayed healing, asymmetry, changes in nipple or skin sensation, and the chance that the breasts may not heal with the exact shape or balance you were hoping for. Because this procedure involves implants, there are also implant-related concerns such as rupture, wear over time, rippling, shifting, firmness caused by recurring scar tissue, visible contour changes, or the need for a revision later on. Implants are not lifetime devices, so even when surgery goes smoothly, removal or replacement may still be needed in the future. Smoking, nicotine exposure, certain health conditions, and some medications can also increase healing risks and make complications more likely. There is also the possibility of other unforeseeable complications that I cannot predict. Let's also talk about the possible benefits and the other options available to you. The goal of this surgery is to improve a problem caused by scar tissue, implant changes, or pocket shape issues while giving the breasts a softer feel, better position, or a more comfortable and balanced appearance. For some patients, this can also be a chance to change implant size or update older implants. Alternatives do exist. You may choose not to have surgery, remove the implants without replacing them, consider saline implants instead of silicone implants, or in some situations use your own tissue for reconstruction. Choosing no treatment is also an option. Each path has its own trade-offs, and my role is to help you understand which choice best fits your needs and goals. Here is what you are agreeing to when you sign this form. By signing, you are confirming that we have reviewed the purpose of this revision surgery, the expected benefits, the alternatives, and the possible risks. You are giving me permission to perform open capsulectomy and silicone implant exchange as discussed, and to make reasonable surgical decisions if unexpected findings come up during the procedure. You understand that implants do not last forever, that future surgery may still be needed, and that no operation can guarantee perfect symmetry or a permanent result. You are also acknowledging the risks related to anesthesia, healing, scar formation, and implant-related complications, along with the importance of following all post-op instructions carefully. Before you finish, let me bring everything together. This procedure is designed to treat scar tissue around an implant and replace the implant in a way that can improve comfort, shape, and overall breast appearance. It is important to understand that this is still a revision surgery with real risks, and that implants are not lifetime devices, so future surgery may still be needed down the road. My goal is for you to feel informed, comfortable, and clear about your decision before signing. You can now sign this form by scrolling down to the bottom. Please enter any required initials, dates, and signatures requested. You will be emailed a copy of this form as soon as you submit, and the office will receive a copy as well. Thank you, and we look forward to taking care of you.